Well, I mean, that's still pretty new information coming out, so we're looking at that. But I think it's important to note that CMS is there's a lot of regulatory components there that ties to federal funding for these centers. So they're going to have to take a look at what those requirements are coming down from the federal side. And if they're not complying with those, it does sound like they would be risking some funding from CMS in the way of reimbursement and such. So we need to work closely with them and try to figure out what that impact is. We've encouraged vaccinations among all their staff since the beginning. This is our most vulnerable populations when we talk about long-term care centers, and it's very important area that we provide as much protection as possible for those individuals. So I think there's still more information to be uncovered on this and to understand, and we'll continue to work with the individual centers and the associations that represent them to try to figure out what that impact will be. We all recognized that on the initial rollout, the program that was set up with the federal government for long-term care centers did not go as smoothly as we wanted. It did not meet really the standards we had as a state for taking care of our most vulnerable population. So we are reaching out now to both associations and individual homes around the state through local health departments to make sure that we have a mechanism in place to get them served as quickly as possible. And yes, that may well include providing vaccine directly through them. If we can get them affiliated with a pandemic provider, getting vaccine to them in order to help them to provide the boosters to their residents, or even those that are looking for the to begin the vaccination series in those areas. So we value the partnership with our long-term care centers. We know it's been a really difficult road for the centers, for the families, for the residents since the beginning of this pandemic. I mean, it's actually been really tragic, some of the challenges that they faced. We want to make this as easy as possible for them, and we certainly want to learn from the initial rollout. So we anticipate a very close relationship with them to ensure this rollout runs as smooth as possible. We have seen some outbreaks among long-term care centers around the state, nothing to the extent of what we saw this past year during the early days of the pandemic. But yes, we have seen some level of outbreak in some facilities around the state.
For more information, you can visit tulsaworld.com.